Hello and welcome to Wisconsin Doctors. I'm your host, Jessa Jeremiah. We are filming today at Upland Hills Health in Dodgeville, Wisconsin. Later in the program, we're going to be joined by the staff of Upland Hills Health Home Care and Hospice. So if you or someone you know may be in need of care and have some questions, you're going to want to stick around. We're going to be joined today by Jennifer Mobley, who's a physical therapist in home care. We've also got Ashley Rubish, who is a nurse in home care and hospice, and Shannon Radel, a hospice social worker and also part of the grief support group. We're going to be learning today about how you might qualify for home care, who may need hospice and when to call, and a lot about how these services can help improve the quality of life for patients and their families. It's all here on Wisconsin Doctors, here at Upland Hills Health, and we'll be right back. Hi, and welcome back to Wisconsin Doctors. I'm your host, Jessa Jeremiah. We are filming today at Upland Hills Health in Dodgeville, Wisconsin. I am joined by the staff of Upland Hills Health Home Care and Hospice. I've got Jennifer, Ashley, and Shannon with me today. Thank you for taking some time with us.
Thank you.
I'm looking forward to our conversation. I have a lot to learn and a lot to cover. First, we're going to get to know the three of you a little bit and about your specific profession. So share with us, we'll start with you, Jennifer. Give us your title and what you do.
So my name is Jennifer, and I'm a physical therapist with Upland Hills Home Health. I have been a therapist for over 20 years now, and I've worked in all different settings, inpatient, outpatient, skilled nursing facilities, and for the last 10 years here at Upland Hills in home care, and is by far my favorite setting.
Congratulations.
Thanks.
Excellent. All right, Ashley.
I've been with Upland Hills now for 6 years. I started as a nurse 11 years ago. I've had experience in the hospital setting, so that's brought a good background to my setting now. Now I do both home care and hospice with Upland Hills, and I would also say that this is by far my favorite setting of healthcare also.
Oh, excellent. And let's talk to Shannon a little bit about your position.
Yeah, I'm Shannon Radel. I'm the hospice social worker, and my background has been within behavioral health and staff education, primarily in long-term care, but I'm actually from Spring Green, just down the road from Dodgeville, and received my master's from the University of Tennessee several years ago, and I've been in social services for about 15 years, so, and with Uplands for almost 2.
Excellent. We've got the dream team here for you today. We're going to learn more later in the program, of course, about some of the specifics, but Jennifer, I want to talk to you about in-home care. What would you say to a viewer who wasn't familiar with what that means? What is it?
Well, if a person is in the hospital because they injured themselves, they had a surgical procedure done, or they just had an illness and they go home and they're not quite strong enough to go to an outpatient setting to receive services, we can go in to provide those services in the comfort of their own home.
Okay, and then that differs from hospice care. So Ashley, what would you explain to somebody who maybe was just learning for the first time what hospice care really means and does?
So hospice is more an emphasis on caring for the end of life. And honestly, it is about making sure they are as comfortable as possible and still being able to be surrounded by their loved ones, who really, that's the most important thing for the patient at that time.
Absolutely. And Shannon, a hospice social worker, and you also are part of a grief support group. So what does that mean and what do you do?
So one of my goals is really to be with the family and present or be calm with them and present with an open mind, but finding out what's important to them and how they really want to spend the last months of their life and attempt to make the process of dying a bit easier by navigating some of the emotional and practical aspects of end of life.
Absolutely. You have some big jobs and a really important one. So this is the team we've introduced you to, the Upland Hills Health Home Care and Hospice, some of the staff. We have a lot to cover, but that will serve as a good backdrop for us as we move forward. So we're going to be back with more. Sound good? We'll return here at Upland Hills Health Home Care and Hospice after the break, so stick with us on Wisconsin Doctors. Hello and welcome back to Wisconsin Doctors. If you are just tuning in, we are filming today at Upland Hills Health in Dodgeville, Wisconsin, talking to the staff of Upland Hills Health Home Care and Hospice. Thank you so much for returning with us, Jennifer, Ashley, and Shannon. Before the break, we got to know them a little bit and talk a little bit about their profession here at Upland Hills. We want to talk more now, dive into the home care aspect. So talk to us, Jennifer, about when it's appropriate for someone to receive home care. How does someone qualify for that, for example?
Well, as I mentioned before, a lot of times if people are in the hospital because of an illness or an injury or surgery and they leave to go home, they have a medically necessary need for a skilled service like PT or OT to come in to work with them to help them get back to their prior level. One other aspect of it is most instances they do need to be homebound, which means it just takes a considerable and taxing effort for them to leave the home so that they can't get out to go to like an outpatient clinic to receive the services, so that it's appropriate for us to go in and work with them.
So that's where you step in and save the day, because there's a lot of services that you provide. So we're going to talk about the different disciplines. Let's start with therapy.
So our agency offers physical therapy, occupational therapy, and speech therapy. Physical therapy, we are movement experts, so we'll go into a home and assess a patient, looking at their strength, their balance, how they're getting around the home, to see what areas we need to work on to help them be safe in the home, to prevent falls and going back into the hospital. And then our OTs go in. They'll assess, and they're looking more specifically at activities of daily living, like dressing, bathing, getting in the kitchen, and doing those sorts of tasks. And then our speech therapists, for example, would be called in if someone had a stroke and they're having difficulty communicating or swallowing or with their cognition. Our speech therapists can go in and work with them in that instance.
A lot falls under that category of
Yes.
therapy.
Yes,
You can
we
see.
all work together. So.
Yeah, absolutely. Now, Ashley, you're a nurse in home care and hospice. Let's
Yes.
talk about nursing in the home care side of things specifically. What does that look like?
So in the home care side of things, we are doing more things like IV medications. We do PICC line dressings. We do lots of wound care. We also help people set up medication planners and help them get educated on their medications. Other things that we can do is educate them more on the disease process, what led them to the hospitalization, and educate them to prevent further hospitalizations is a key important part with the nursing aspect of it.
Lots to cover, and I like that you talk about preventative methods
Yes.
too, because some things could be reoccurring, and
Yes.
you can help them prevent any future issues. So we have a lot to learn. We're going to talk about hospice after the break, but one of the things I wanted to touch on before we get there is you both mentioned when we were doing our introductions that you find these jobs so rewarding, all three of you. Let's first talk about home care and why, Jennifer, what is so rewarding for you about this profession?
Well, I love it because we get to go in someone's home, which typically tends to be their comfort zone. So they're more comfortable there. We get to provide one-on-one care. We don't have the distractions that you may have in a clinic or a hospital sort of setting. And we get to work with them right in their environment. So if they're having a problem getting into the shower or getting out of their bed, we can work on it right there. We don't have to simulate it like we would in a hospital or in a clinic. So.
Well said. Yes,
Yes.
absolutely. And Ashley, for you, it's a
Yes.
little different, but
And
I'm
it
sure
is.
very rewarding.
Yes, and sometimes it is interesting to go into their homes because you kind of can see maybe things that led up to the problems that are obvious when you're in their homes, but you cannot see from the clinic or the hospital setting.
That's a really good point. You kind of get to
Yes.
do some of that investigative work
Yes.
on site.
Yes.
As I mentioned, we're going to talk more about hospice after the break, but Shannon, talk a little bit, might be a good lead-in for us about why you find your work so rewarding.
I really appreciate learning about people and learning their story and
Yes.
kind of the history of who they are. I mean, one of my first questions when I meet someone is, tell me about you. You know, where are you from? What did you do for work? And just really trying to see the world from their vantage point and going into it with a curious mind. And that's what I like the most about going into people's homes and this work in general.
It's heartwarming listening to you three because it is such important work, and to have somebody on your team that is so thoughtful and truly caring and truly enjoying what you do every day, that's who you want to be working with. So we're going to learn more about hospice after the break, so please stick with us. We'll be right back with more Wisconsin Doctors. Hello and welcome back to Wisconsin Doctors. I'm your host, Jessa Jeremiah. We are filming today at Upland Hills Health in Dodgeville, Wisconsin. We are talking to the staff of Upland Hills Health Home Care and Hospice. We've met the staff, Jennifer, Ashley, and Shannon, talked a little bit about backgrounds and why this job is so important and rewarding. We also dove a little bit more into home care, and right now we're going to talk to you about hospice more specifically. So thanks again for being with us today. Ashley, let's start with you. I think one question that viewers might have is, we talked about when it's appropriate for home care. Let's separate that a little bit. When is hospice really appropriate?
Hospice is appropriate. A lot of times your doctor will have a conversation with you regarding a terminal diagnosis that you may have. And a doctor will say that it is probably looking at a life expectancy of less than 6 months. And that's a lot of times the doctor makes a referral to us, or he tells you this and you can think about it, and they give you numbers of different hospice agencies to go to.
Got it. So really, obviously different than somebody who's in need of home care. Now, typically, who is the person on the other end of the phone when you get a phone call? Who's calling and why do they call?
We have a nurse that is an intake nurse in our office, and she does a lot of the calling to talk with the family beforehand and just to see where they're at with the process and see what questions they may have.
Okay, so of course, big list of questions is what are some of the services that you provide? Who is going to be providing those services? We could probably talk about that for an entire show, but give us a broad idea.
So the idea of hospice is really to have an interdisciplinary approach and knowing that there's a team who is going to be navigating the system and helping our patients. And so we work with the medical director, we'll work with the patient's primary care physician, myself as a social worker, of course, but we have skilled nursing aides who will go in and help with, activities of daily living such as bathing or just general assistance around the house. We also have a hospice chaplain. We know that faith is really important to a lot of our patients and families, and we want to make sure that that's on the table for them as well. And then we have volunteers who can go in and, play a board game, talk about their favorite topics, really just provide companionship.
A lot of important services. Mm-hmm. This is a heavy topic for some of our viewers watching, especially if you might be somebody that is questioning whether or not it's the right time to call hospice. So what would you say to a viewer who's kind of in that space of, is it right for me right now?
I would always say, if you're considering it, call the office. Talk to the nurse. We can always set up an informational visit where you and your family can sit down with the nurse or the social worker and have that more one-on-one time to see where you're at in the process.
Mm-hmm. And why Upland Hills Health Home Care and Hospice?
I think that we have a really great opportunity being in Dodgeville and being connected to the hospital system, but also we know the local resources and we can assist the folks within our service area, which is approximately 30 miles radius of Dodgeville, and really working with those folks to ensure that they have things that they need in place.
So I think we learned a lot today, really about what this service is intended to provide, who is really ready for hospice care. But ultimately, if you're not sure, there's resources here to find out if it's the right time. And Upland Hills Health is a great place to do that. So Upland Hills Health Home Care and Hospice, there's a lot of services that you do that provide a great quality of life. You touched on that, Shannon. We're going to talk about it a little bit more in depth after the break. So make sure you stay with us here on Wisconsin Doctors at Upland Hills Health in Dodgeville. We will be right back. Hello and welcome back to Wisconsin Doctors. I'm Jessa Jeremiah visiting Dodgeville today. We're at Upland Hills Health and we're joined by the staff of Upland Hills Health Home Care and Hospice. You've gotten to know Jennifer, Ashley, and Shannon a little bit throughout the program. Thank you again for being with us and sharing a wealth of knowledge. We're going to get into specifically how these services, talking about, of course, home care and hospice, really can contribute to a patient's and family's quality of life today. So Jennifer, let's start with you. A physical therapist in home care, what are the services that really affect the person's quality of life and why?
Well, I think with home care in general, as a team going in nursing and the different therapies, we're working with the patient and the caregiver to help those people, in some instances, just to stay safe so they can remain living in their home like they want to, and be safe and not end up back in the hospital or end up having to go to a different facility. So that means a lot to people. And sometimes we're working in a different direction to try to get people more mobile again so they can resume their community outings and participate in community functions like they used to, which means a lot to a lot of people. So we're all working together to help them just to live their best life.
Right, their best life, if possible, to
Yeah.
stay at home and stay safe. Now, are appointments typically scheduled, or is there an opportunity for somebody that might need care quickly?
Yes. So we have an appointment. We have a CNA that calls every day, the day before, for the appointments the next day and finds a time that works best for the patient and their families. And then we also have a nurse on call 24 hours a day, which is a huge benefit because if there's ever anything that happens, there's always a nurse on call, and then we respond as quickly as possible when we do get called out.
That's comforting to know, certainly. Let's move on to some of the quality of life aspects of hospice. We touched in the break, or before the break rather, about some of the services and who is involved. Ashley, give us a little bit more information about services, things like pain management and how it really helps them.
Yes. I always say the most important thing is making sure they're comfortable so they can enjoy life to their fullest. A lot of times people come to us and they've suffered with problems with nausea and it's getting the right medication or pain control, other problems, just whatever it takes, whether we bring in equipment. Sometimes people need a wheelchair or a walker because they can't walk across their house anymore. So as a nurse going in there, you're finding what they need. And when you provide these things, a lot of times they tend to do a little better right away when they get on because they have all those things that they were just missing.
Really helpful. Wow. Okay. So we're going to move on to talking a little bit about grief support and what it could potentially mean, not just to the patient, which we've touched on quite a bit, but also to the caregiver. And that's something, Shannon, that you have an area of expertise. Let's talk about the grief support group and a little bit about what you do there.
So a lot of folks, as they're going through this journey, are confused as to, is there a right way to grief? Is there the best way to kind of move through this? And you know, I'm here to say, and with the grief support group that we have at Upland Hills, that there isn't a right way. It's a very individual process, but we want to, you know, go about it with hope and helping them find hope and helping them find the strength to kind of move forward and normalize grief. You know, we all experience grief at every level throughout our life, and you know, we want to make sure that it's the most positive experience possible. If that's, you know, it is possible, but I know sometimes it doesn't feel like it might be.
Yeah, absolutely. So it's nice to know that there are so many resources here available for patients out there, potential patients, families that are going through this. What do you think is a good first step for someone to kind of close our show, for somebody who's watched the episode today and thinking about the potential need for home care, the potential need for hospice, somebody who might need some grief support? What do you think is a first step?
We're just a phone call away. We're local people in the local community, and we're just a phone call away. I think that's the best thing. Just know that we're here and we're willing to take care.
Yes, we've shown you the expert staff here, a lot of knowledge here at the table today. Thank you for sharing what you know and your time with us.
Thank you.
This is Jennifer, Ashley, and Shannon, the staff of Upland Hills Health Home Care and Hospice. And this is Wisconsin Doctors. We're here at Upland Hills Health in Dodgeville, Wisconsin, and that's our show. I'm Jessa Jeremiah, inviting you to live longer and live better.